Hello, I'm Dr. Alexandre Amato, a vascular surgeon at the Amato Institute, and kicking off the month of June Lipedema, which is the awareness month for lipedema, we're going to talk here about the psychological impact of lipedema, what the mind suffers with this disease. It's a topic I love to discuss. Lipedema, you can see here on the channel, there's a huge playlist full of videos about lipedema. We've been talking about it for a long time here on the channel, and now I think it's time for us to update some concepts that are being discussed out there, especially because lipedema, just so you have an idea, in the last 5 years, the same amount of scientific articles has been published as in all the previous years since its first description back in 1940. What does that mean? That there's a lot of scientific publications coming out in recent months, and I am very proud to say that here at the Amato Institute we publish extensively in the international scientific literature about lipedema. So today we are going to talk about the mental aspect. We will address all these psychological issues and strategies on how to tackle this problem. After all, lipedema is not just an aesthetic issue, much less just a problem of fat deposition in the lower limbs. It is a metabolic problem that affects the entire body. And if you are not aware of this, you might end up thinking that just removing this fat from the leg solves the problem. Is far from it. The first aspect is anxiety and stress. Anxiety and stress can cause inflammation, and lipedema thrives on chronic, low-grade systemic inflammation, the kind that lingers in our bodies all the time. So if we, for some external reason, experience an increase in stress and anxiety, we'll see a rise in this inflammation in our bodies. But the reverse is also true. So as we experience an increase in this inflammation in our bodies, we respond with more anxiety and stress. And this ends up creating a negative cycle, a downward spiral, where many women get caught and can't escape without proper guidance. I find it curious that many of these women are extremely anxious. They notice this anxiety, but don't realize how it impacts their lives. This anxiety, this stress will alter the circadian rhythm. These women have trouble sleeping, they sleep little or with non-restorative sleep, but the disruption of the circadian rhythm will also worsen this anxiety and stress. So there are several factors at play. For example, the coffee, some people have a genetic mutation that makes them extremely susceptible to the impact of caffeine on anxiety. And I see many people with anxiety at its peak, and they don't give up their coffee. Isn't it worth trying to go a few weeks without coffee to see if it's affecting your life? Do you have coffee every day with caffeine? I want to know, tell me below. How much coffee influences your anxiety? Have you ever stopped to pay attention to that? Your body speaks. If you pay attention to the signs it gives you, you'll notice if there's difficulty sleeping, if there's a mood change in any way, and taking some time off and then reintroducing, you'll notice more. Another important aspect to mention is the stages of grief. This is well documented in the literature, the 5 stages of grief. But you're talking about lipedema, why start talking about grief? Because it's not just grief. Despite the name stages of grief, this can happen with any bad news. So when you get, for example, a diagnosis of lipedema and you might consider it bad news, you can go through these 5 stages of grief, which starts with denial. Denial is, the problem isn't mine. I don't know, I don't have it. It's not me. You're talking to someone else. In the case of lipedema, it would be the doctor giving the diagnosis of lipedema and the person closes their ears, right? Says, I don't have it. I don't have lipedema. I went online, saw the pictures. It has nothing to do with me. I have nothing to do. The problem with the denial stage is that if you don't consider the problem to be yours, why would you need to solve it, or why would you need to take the next step to try to improve your life? After all, you don't have this problem. So denial is just that. It's a bad phase. Usually it's the first phase where you stay still, do nothing about your problem. The next phase is the anger phase. The anger phase is, damn, why me? I don't deserve this. It's the anger at the news, the bad news of the diagnosis of lipedema. Gosh, all my friends are fine, and I have lipedema. How infuriating, right? And that would be the anger phase. And you know, everyone goes through it. Many times these phases are short phases, right? It can be a few hours or sometimes even days. And the problem with the anger phase is that, again, you're in an immobile phase where you won't lift a finger to improve your quality of life. And many times I see that the anger is being directed at the fat, which is disproportionate to the problem, and a misunderstanding of what lipedema represents. After all, lipedema is the way your body found to protect you from inflammation. So you may not like the fat, may not like the aesthetic aspect that it presents, may not like all the symptoms of pain, heaviness, fatigue that may appear in your legs, but you have to recognize what lipedema is. Lipedema is your body trying to protect you from a bigger problem that's chasing you, which is inflammation. So when you feel pure anger, 100% anger about this, you haven't understood the problem. You need to have actually a love-hate relationship. It's okay, I understand that lipedema is helping me. It's protecting me from this inflammation. And I understand that I don't like lipedema because of the visual aesthetic aspect and the symptoms it brings, but you need to have this duality. Because if you didn't have it, if you just remove the lipedema, you'll have a huge problem to deal with later, which is the inflammation, without the lipedema to protect you. But the third phase is the worst of all. It's the bargaining phase. It's the phase where you try to negotiate with the universe some solution to your problem. Okay, so I have lipedema, so I want to pay for this problem to go away. And that's where many people take advantage of those with lipedema, offering miraculous solutions like pay here to get your solution. And the solution can be anything, and it could be a surgery that will solve the problem. But I can tell you now, it won't. The solution could be a miracle pill, or the solution could be now a miracle course. Folks, there is no miracle solution for the problem of lipedema, because lipedema is not just the fat disease. Lipedema is a much more complex metabolic problem than that. So be very careful with the bargaining phase, because the bargaining phase will also interrelate with the impulsivity related to ADHD, which is also connected to lipedema. We'll talk more about this later. Stay alert when you have this urge to solve the problem. Oh, I'll pay here, I'll sell my house to have this surgery, because the surgery will solve my problem. You've been carrying the problem since you were born. You may have had symptoms later because the inflammation took longer to appear. You don't need and shouldn't impulsively solve the lipedema problem. First, you need to understand your body before going through a process that is irreversible. The next stage of grief is the depression stage. The depression stage is that, oh, whoa, only me, oh dear. Everyone can go through this phase of depression. Then there's depression related to lipedema. Inflammation also causes depression. Now it's more common ADHD as a cause. As a consequence of inflammation than pure depression. Anxiety, ADHD is much more a common response. among women who have lipedema than depression, but depression is there, so we have to stay alert. It's a shadow we must always be concerned about. Listen, folks, removing the fat won't solve this problem. And then comes the fifth stage, which is the stage of acceptance. This, indeed, is the best stage to be in regarding the lipedema diagnosis, because when you accept the problem, you say, okay, I understand, I have lipedema, I accept it, so what do I need to do to improve? So this acceptance of responsibility, acceptance of the fact and acceptance that lipedema is a response of your body to another problem. You can take the next step, you can ask yourself, okay, so what do I need to do to improve? And just that is already a huge step towards improving quality of life, and improving the condition, improving aesthetics, and improving everything else. If you do not accept that the problem is yours, you will end up placing the responsibility on the doctor to resolve it. We are here to offer support. We can lead the way. We can provide guidance, distinguishing between what is beneficial and what is harmful. By not recognizing this and burdening the doctor with 100% of the responsibility, the doctor's main recourse is surgery. However, this neglects all other essential steps required to address the significant issue of inflammation. The onus of managing lipedema rests with you, not the doctor. The doctor can guide you, steer you, put you on the right track, recommend medications that might help you and those that might not. They can perform surgery in rare cases where it's necessary. Most cases don't need surgery. However, the doctor cannot be held accountable for completely eradicating this disease from your life. If you believe the doctor can eliminate this disease from your body and you won't need to take any further action, it's because you're overlooking the details, you're not reading the fine print or the footnotes, and be very careful. Another very frequent aspect is what some people understand as body dysmorphia, but I completely disagree. It's not a body dysmorphia, it's a disproportion between what the person sees of their own body and what people around them end up seeing. Some people have more, others have less. And all of this depends on the amount of inflammation in the body. What does that mean? It means that when a woman with lipedema has very high inflammation, she will see much more in her body than other people see, because other people aren't looking for those signs of inflammation. They are seeing what is visible, what's there. Now, the woman with lipedema who has a severe inflammation is exactly that woman who, after surgery, and who will keep the severe inflammation, might not see an improvement in her aesthetic complaint, because she will continue to see in some way this inflammation. Another very important psychological aspect is what we recently published in a serious international scientific journal about the correlation between ADHD and lipedema. So what is ADHD? It's Attention Deficit Hyperactivity Disorder. Although in women, hyperactivity is more uncommon or less frequent, it's the ADD, attention deficit, and personally, I disagree with the name. It shouldn't be attention deficit, but rather an attention variation. These are people who can't focus at certain times, but for what they truly enjoy, they can give all their attention, which is called hyperfocus. I have an entire video discussing ADHD, so if you want to dive deeper into it, just watch it here on the channel. But let's talk about the psychological aspect of ADHD related to the lipedema. If women with lipedema have a higher probability of having ADHD, what's the significance of that? The significance is that ADHD involves a lot of impulsivity. This impulsivity can lead to making inappropriate decisions. often about surgery. So it's that situation where they go to the doctor and the doctor suggests surgery as the first treatment for lipedema. This woman with ADHD will think, wow, that's great, there's surgery, so I want to operate by yesterday. That's the impulsivity. But those with ADHD and those who have lipedema don't have a mental deficit, nothing like that. They don't lack IQ, far from it. They are very intelligent women, and they will realize at some point that that decision was a decision guided by impulse, and that it wasn't thought out and decided based on their body, on what they know about their body, the disease, or even on real facts and related to their symptoms that they've seen their whole life having these symptoms. Then someone presents the miraculous solution, and because of this, impulsivity decides to operate. They won't give a chance to try conservative treatment and see that there really is a significant improvement in quality of life and in the cause of the disease, which is inflammation. And then what comes? Regret comes. So what I get here in the office are women who have already had leg surgery, have already had liposuction on their legs, and are unhappy with the results, are clinically out of control, have a metabolism. That's extremely difficult to manage. Many times they had leg surgery without even knowing about the lipedema diagnosis. It was an aesthetic desire back then, and they found a plastic surgeon who would do the surgery. And nowadays, with the emergence of lipedema in the media, I see many surgeons operating, saying it's lipedema, and presenting it as if it were the definitive solution to this issue, and it's not. But ADHD now has another aspect, which is also the dopamine issue in the frontal region of the brain. Dopamine is our neurotransmitter that signals reward, right? Everything we do that releases dopamine, we like it, and then we tend to do it more often. So this dopamine, it's linked to various behaviors we engage in daily, and many times we end up choosing the wrong dopamine. What do I mean? All addictions release some dopamine, because otherwise it wouldn't become an addiction, right? So what do I mean? Cigarettes. Cigarettes release a bit of dopamine in the brain. This dopamine gives a feeling of pleasure, and it encourages the person to smoke the next cigarette, just like a little snack. So that food you're not hungry for, but you want to nibble on, you eat because of the dopamine release. And then it ends up, you like it, right? Then you end up in a vicious cycle of eating multiple times to get that small dose of dopamine in the day. Or on social media, that thing of constantly scrolling up, it gives a microdose of dopamine to the brain, and then you scroll again and again, and you get stuck in a cycle you can't break. Other addictions, like shopping addiction even, pornography addiction or drug addiction, where most drugs release a bit of dopamine, and sometimes it's not just a bit, it's a lot. And that leads to taking the next dose. So do you have any addictions? Write them down in the comments below, I want to know. But speaking of addictions that release dopamine, there's also healthy dopamine. Healthy dopamine is found in physical exercise, but it has to be an exercise you enjoy. If you do an exercise you don't like, dragging yourself to do it, forget it, you won't get any dopamine out of it. You can squeeze it all you want, but not a drop of dopamine will come out. So often at the beginning, you have to do a bit of exercise, even if you don't like it, just to gain a bit of motivation, a bit of functional capacity to be able to do the exercise you enjoy, right? For example, if you like dancing but don't even have the stamina for it, you need to start by walking and then progress to dancing. Now, if you understand that your brain is seeking dopamine, At that moment, for example, there's a brigadeiro in front of you. You want to eat the brigadeiro, and you know you're not hungry. You say, hold on, it's my brain looking for some dopamine. You can provide a dopamine boost at that moment that lasts longer and is healthier. The dopamine from this brigadeiro will last a few seconds, maybe minutes. But if you do some exercise, even if it's a 30-minute walk, that dopamine will last for hours, and then you won't keep seeking these small harmful vices for your body, which are also inflammatory. Having discussed all these main psychological aspects of lipedema, what can we do to improve? I've already mentioned a few things here, talked about coffee and anxiety, talked about exercise and its relation to dopamine, but exercise also has an impact on inflammation. The only way we have in our body to release anti-inflammatory substances and fight inflammation is through moderate intensity exercise. I have several videos here on the channel talking about physical exercise, especially exercise for lipedema. And I have also even written a book about exercise for lipedema, where I discuss a lot about inflammation and physical exercise. But to summarize, it's very important that physical exercise is daily and moderate. No one is trying to create a marathon runner overnight, especially women with lipedema who already have a loss of muscle mass. You can't start overdoing it, because then it will hurt and you'll give up on exercise. But diet is also very important. We aim for an anti-inflammatory diet to combat the root cause of all this. But there are other tools as well, like meditation. Meditative techniques can help reduce inflammation, improve the way you handle your mind. Breathing exercises, prolonged inhalation and prolonged exhalation also have a significant impact on our mind. Is also very valuable. Finding a good professional, a professional who is dedicated to helping you with self-awareness, will help a lot in this quest for reducing inflammation and improving mental health. Yoga also involves exercises. It has an exercise aspect and also works at the same time on how we deal with our mind. So yoga, especially pranayama yoga, which includes breathing exercises. And there are also many medications. Remember that medication is the doctor's responsibility. Your responsibility would be to take the medication as prescribed. And this varies greatly from case to case. There's a very unique bio-individuality in lipedema. What worked for one person won't necessarily work for another. So it's not just about taking what your friends with lipedema are taking. The issue is much more complex than that. I participate in a lot of vascular surgeon forums, and the other day someone asked me, oh, what's the secret formula for lipedema? Guys, there is no secret formula. It depends on the patient, it depends on the underlying cause. The big question, I think the big formula, the big secret, is this question here: what triggers your inflammation? The day you manage to solve and answer this question, the problem is solved. So, did you like this video? Subscribe to our channel, share it with your friends, grab the link above, send it to everyone you think might have lipedema, comment below what you liked, what you didn't like, what worked for you and what didn't. This is very important, because I want people who watch this video who are suffering from lipedema to read the comments below, because then you'll identify with one problem or another. You'll see that you're not alone in the world. There are many dedicated people, although there are also many taking advantage of lipedema and trying to sell you a miracle solution. There are many serious people trying to help you. There are many serious people studying and producing real scientific content to change the course of lipedema worldwide. So let's go. I'll put the best video for you to watch next.